with our host, Tom Quigley of Claim Links. Tom, what's going on?
Not much. Hanging out in the snowy Massachusetts, I guess.
Well, all the snow kind of melted in Ohio, which is surprising. Early spring, but I'm sure it won't be in a couple weeks. It's skunk season, so I know you missed that like everything. But our
Yeah.
topic today is why your health plan is secretly a profit center, just not for you. All right. So when an employer pays a premium, where does that dollar actually go, Tom?
To various vendors and people associated. You got commissions with insurance agents, you got PBM fees, you got insurance costs, goes to states, departments of insurance, premium tax. It goes everywhere. Except the employer's pocket, he gives it away or she gives it away.
How do
So,
PBMs actually make money on employer plans?
oh, they get rebates. So they're making all kinds of monies on rebates and dispensing fees and all these other fees. And a lot of times the insurance companies get them. They pass it through so the insurance companies keep them. It's a good scam they got going.
And why do you think that is a scam, Tom?
Because if you bought directly from the manufacturer, you'd pay 90% less. But they
Interesting.
all go through these third-party vendors. It's similar, like I always bring up lobster, same deal. If you buy it right off the dock, it's $2. You get it at the store, it's 12. Same deal with drugs. Legal drugs, I might add.
Why are employers paying 300 to 800% of Medicare rates to hospital systems?
Because the hospitals are corrupt and they can get away with it. Because they're all they're doing is their administrative is inflating costs and there's no system to control them. There's people who fight them and stuff and negotiate it down, but I mean it's a system that, again, the government steps in and puts their foot down on some of these. We'll see rates go way down.
So why are we as paying for Medicare rates? That's my question. Especially the
Why
employers.
is who? Why
The,
aren't we the employers?
yeah.
Again, you're running with thieves. They've got everyone duped. The Congress people are paid off. The senators are paid. Everyone's paid off, man.
Got it.
So what you got to do is you got to beat them at their own game. Take the system, use it to your advantage as an employer with tax breaks and laws, and save lots of money with a system that's flawed.
What role do carrier-owned provider networks play in profitability?
Say that again, please.
What role do carrier-owned provider networks play in profitability?
Well, again, they're negotiating with the big hospitals and are negotiating with the insurance companies for higher rates than what you alluded to, than Medicare, 300 to whatever percent you said.
That's ridiculous.
You're running with thieves, dude.
How is employer health data monetized?
Well, because the HIPAA laws, they don't have to say who. They make everyone think everyone's using it. But the reality is 8 out of 100 Americans under the age of 65, or those not on Medicare under, hit a $5,000 deductible. And 4 out of that actually have to pay the deductible. And then 20 out of 100 hit a 500 deductible. So
Yeah.
the system's, I mean, the casino's winning. Let's just put it at that.
If healthcare is a profit center, who is absorbing the cost of the profit?
The employers, the employees, everyone who pays for it.
Have you seen a lot of bad stories that have happened because of the increase of rates and premiums?
Yeah, you have people going uninsured and people who are, they don't understand the system, so they're making terrible decisions or paying way too much. And it's a shame.
All right. Best place to go to schedule a call at Tom the 8 is go to claimlinks.com, Tom. And you think this is not going to change anytime soon? Healthcare costs.
I think it'll change when the Congress and senators have term limits. So you answer when they have term limits, maybe this will change.
Got it. All right. That was a special simulcast of the Neil Haley Show and the Cutting Edge Benefits Podcast, guys. Take care.